Good afternoon, everyone, and welcome this afternoon to Immunizations plus Children's Health plus Social Good. We are here as part of the plus Social Good community today to really talk about a very, very important topic of ending childhood mortality, but really of ending preventable childhood deaths. And to talk about that today, we really have to focus on the incredible importance of immunizing children in the hardest to reach parts of the world. My name is Debbie Thomas, and I'm the director of the Shot at Life campaign at the United Nations Foundation, and our focus is to increase access to life-saving vaccines for children in developing countries. 1 in 5 children do not have access to the vaccines that they need to make it to their 5th birthday. So this is a really important moment in time for us, not only as we count down to the last days of the Millennium Development Goals, but as we look to the UN and other international development partners and NGOs to keep fighting this fight, to be on the right side of history here to make sure that we're ending preventable childhood deaths. So joining me today, I'm very excited to announce Dr. LaVonne Downey, who is Associate Professor of Public Administration at Roosevelt University and a Shot at Life champion, like many of you who have joined us today on this Google Hangout. Dr. Downey has authored or co-authored over 70 articles on a range of topics. Her research focus is on identifying and solving healthcare issues, etiology and effects of changes on standards of care, especially for the underserved. She is a member of the editorial board of Southern Medical Journal, the Journal of Hospital Administration, International Emergency Medicine, Dataset and Papers in Medicine, and a reviewer for several medical and public health journals. We're really honored today to have you, Dr. Downey, as one of our Shot at Life champions and as an expert on this call today. Dr. Downey is going to take us through a journey today where we discuss how unvaccinated patient zeros traveling within our interconnected and incredibly global world can put entire populations, particularly children, at risk in contracting dangerous diseases. And after that, we're going to take you on a little journey of our own of the things that we can do sitting here right at home to help end preventable childhood deaths. And with that, I'd like to turn it over to you, Dr. Downey.
Thank you, Debbie. First of all, welcome to everybody, fellow champions, concerned citizens, interested people of the world. One of the things that I want to talk about today is, and I like to refer to it, it's sort of like the sound and the message you get when you're on the underground in London. We need to start minding the gap, because what we're seeing in the United States specifically is we're seeing an immunization gap occurring. As far back as 14 years ago in the 2000s, we had 0 cases of measles, we had polio under control, we had all kinds of systems in place. 95 to 98% of our kids were immunized, and we were the leader, the world leader in how it was done and how effective it could be and what kind of health and increase in children's health you could achieve by doing universal immunization. A funny thing happened, though. Starting in about 2012, we started to see more and more cases appear. And in 2013, in the 6-month period, we saw 158 cases of measles, which was very concerning. That's gotten worse. As of 2014, we have seen up to 200 cases. And they're not occurring everywhere, and that sort of raises the question of why is that? I mean, we know things like polio, places that used to be internationally free from polio cases, such as Syria, other places, they're seeing a resurgence in part because of civil wars. People are having to migrate forcefully other places to other countries. They're not getting immunizations because they're on the move, but we're not seeing any of that in the United States. So these were very concerning numbers that we started to see. And one of the things that we saw was that these outbreaks were sort of in clusters of people, which again didn't sort of make intuitive sense of why it was happening. And we looked at overall immunization rates, and they were really great. We saw that about 90 to 95% of kids were immunized by the time that they were in kindergarten. However, these outbreaks kept occurring and got bigger and bigger and bigger. And we also saw a similar thing happening overseas in places like the United Kingdom and France. For instance, there have been 2,000 cases of measles in the UK alone this year that they've seen. So we have lower numbers, but the surges are even bigger in places where they used to have 100% immunization rates. And what we started to see when we looked at sort of patient zero, and that's sort of who's bringing these in within these clusters, and it seems kind of funny to call people patient zeros, but we traced it back to, in one case, a 7-year-old child. And what happened was he was unvaccinated, and he was unvaccinated because his parents were worried about immunization safety, and they did it based on their own perceptions of what was safe or not. And he lived in a very rich area in California, so what do when you have a summer? You go on summer vacation, and he happened to go to places like Switzerland, and he got exposed to the measles. He, in turn, brought that right back, and the time period is about 7 to 8 days, sometimes 2 to 3 weeks before symptoms start to show up. And by the time symptoms started to show up, we had traced 800 people back to being exposed to measles, and about 300 of those people came down with measles based on one child. Now, of course, why this happened is because where he went back to was also a community that did not have 100% immunization rates. So like-minded people sort of come together, and that meant that all the little brothers and sisters who were either too young to get immunized or also weren't immunized were exposed. Then other people were exposed because, we're all sort of very, very connected in this universal world. And the 800 people was a whole lot. And so we started to think about, well, what's not occurring? And what's not occurring is that people are sort of forgetting that these vaccinations are sort of like an insurance policy for you, that if you are exposed, you won't get the disease. And when I say get the disease, a lot of people think, well, we haven't seen these cases in a long time, and don't they show themselves and we should know right away what they are? Again, I want to go back to in 2000, we had no new cases. So we've got basically 2 generations of doctors who have not been exposed to any of the diseases. So whenever your child goes in, they're not going to know automatically, oh, it's measles, it might be polio. They're going to think it's other things. So it's even going to be misdiagnosed because we've gotten so used to not seeing these diseases on our shores. And we had what was called a herd immunization. And what that means is if enough people, 90 to 95% of people, are immunized, then the people who can't get immunized, and that would be children under the age of 3 months, sometimes older people who are not up to date on their immunizations, people who can't get certain immunizations because they have compromised immune systems, they're safe from the disease because we're not bringing it back and we're not exposing them. And that moat of immunization has sort of been lowering and lowering, and especially in these specific locations where we see that people are not getting their immunizations. And we have to tell you that some of the high levels of what we call exemptors, or people who wanted exemptions from these immunizations, are in some very nice neighborhoods. We have one here in Illinois called Oak Park, and their immunization rates are down to 80%. So we're not even getting to that low level of 90%, it's 80%. So that means that if any child goes anywhere where they're exposed, then they bring that back to their whole community, and their whole community could get sick. Part of why parents think it's okay to be an exemptor is we've been too successful. Just like the doctors, 2 generations of doctors don't see these diseases anymore, these parents didn't know anybody when they were growing up that had these diseases because their parents had them immunized. So they're not even going to know the effects of these diseases, which is a wonderful, successful thing. But it also sort of makes us complacent, and what we see and don't see, we think can't hurt us. And we sort of undervalue the real risk that there is out there. And by the way, measles, if I just went like coughed and I had the measles virus, 90% chance that all the people in my room where I was at would get the disease. That's how contagious they are. The same with polio. And children have to be hospitalized. With polio, there is paralyzation. So it's a lifetime of effects that occur. And you're exposing your child to this for the rest of their life if they do not have these immunizations. We're trying very much to make sure that these vaccines are available and that children are getting them. We've been so successful in other countries thanks to Shot at Life and their partnerships, we've got areas such as India where there's no cases of things like polio, where there 20 years ago we just would have never thought that possible. But now we're seeing this people who are exemptors, and we're seeing it as a sort of what we would refer to as a first world problem. So we're seeing it in Western Europe, we're seeing it in Britain and France and Germany and Italy and Switzerland, and these are all the places that all these people go on vacation, so they bring back all these diseases and viruses to our shores, to communities where there's a low level of immunization, so it spreads very quickly. One of the things that we sort of learn about diseases is that the world is a very small place, and there's a globalization effect. So within 24 to 12 hours, anybody somewhere else, even less, if you've been exposed in Western Europe, you're going to bring that disease back to your community. And if they don't have protection, they could get very, very sick very quickly, especially people who are not old enough to be immunized. And since a lot of these children are young children, they're obviously going to have young siblings. So that's a very huge problem. Because the younger you are or the older you are when you get exposed to these viruses, the worse they are and the worse outcomes we have. What we need to do is get that moat, get that protection back up again. And that's harder than it looks. We've tried many, many ways. Part of what Shot of Life does is they talk about international immunization, and we are so, so successful at that. Now we're just sort of trying to get to pockets where people need it. We sort of need to do the same thing here. One of the things that's so great that we've learned from Shot of Life is that people really do trust their healthcare providers or their sort of village elders, their religious people. And if we can convince people in the community that it's a good thing and they can be in a partnership with their healthcare providers, we can make sure that everybody gets access to immunizations and that we don't see these cases again.
Thank you so much, LaVonne. I really appreciate that insight. I think one of the things that's so interesting about what you said is that, you know, we're really talking, when we talk about the developing world context, about people who don't have the luxury of choice, because if they do not immunize that child, they really are going to be in a place where they are less likely to make it to adulthood, and that's an incredibly harsh reality of some of the places that we at Shot at Life are really able to visit and to help. You know, the other thing about what we've learned through Shot at Life in a developing world context is that we are actually able to talk to the children and talk to the mothers and the parents who are receiving the immunizations, and we do hear that they are walking for miles to receive the immunization, sometimes up to 15, 20 miles, because they've already lost children to these diseases. The other thing that we're hearing also is that sometimes they will not even name a child until the child has received the vaccine, because it is such that moment in time, that passport, if you will, to continue to live a healthy life, a healthy and productive life. So there are all these stories that we can say about people who are craving in some ways for this healthcare early intervention, and other pockets that you're talking about of people who are really choosing not to participate in this because, again, they haven't seen the diseases, and we've been so successful from a public health perspective about really intervening with vaccine preventable diseases, specifically in North America. I want to take a moment to talk to everyone also about my recent trip to Tanzania. We had a wonderful opportunity to go to Tanzania and to take some of Shot at Life's favorite partners with us, and we were able to take Walgreens on this trip with us, and Lisa Guidice, the Director of Marketing for Immunizations, is actually going to join this call, or trying to join this call. There are some technical difficulties, but I'd like to share with you what we saw, and I was there with Lisa, and we had sort of a magical moment, because we were in a situation, we were at a rural hospital outside of Arusha, in parts of northern Tanzania, really at the base of Kilimanjaro, in a big way, and it was sort of a very a place that they say is very close to heaven. That's a local description of the place we were at. And the rural hospital we were at, we saw women, again, walk for miles to come to the vaccine clinic that day. There were mothers who were sitting with their newborns and their very young children to receive the measles vaccine in the waiting room. And we had an opportunity to talk to some of them. A lot of them were Maasai women. That's a tribe that you find in those parts of Tanzania and Kenya. And what was really interesting about those women is that they live very nomadic lifestyles. They focus on livestock farming, or they will really have a very agricultural backbone to their livelihood. So a lot of those women aren't able to get consistent health care for themselves or their families. So when they have a child, there is no real census of that child. He or she is not really counted in the population. And that's what makes immunizations in developing countries so difficult in some ways, but also that challenge which we're really happy to meet, because we want to be able to reach that child who is the most vulnerable. We also met children at orphanages or at family centers where the children were often abandoned by a parent or were in unsafe circumstances at home. We met a young child who thrust his hands into ours, and we were holding his hands, and the leader of the orphanage pointed to them and said, "Look at his hands. His father put them in the fire." And they had burn marks all over them. And this was a young child who came to an orphanage that was affiliated with a hospital and was able to receive his immunizations once he got to the hospital, and will most likely make it to his 5th birthday. So we're very, very excited to be able to really touch populations that are sort of the untouched in some ways, or the uncounted. That's a very a significant place that we at Shot at Life can play through our United Nations partners. The other thing I want to say about the trip to Tanzania, too, and our opportunity to take Walgreens with us, was it really kicked off a national movement here in the U.S. through the Walgreens campaign, Get a Shot, Give a Shot, which is currently going on through Walgreens pharmacies around this country. It's an innovative but really simple idea. If you walk into Walgreens to get a flu shot, you will be able to donate, but just by getting that flu shot, you will be able to give a vaccine to a child in need. Walgreens will be donating that vaccine, a measles or a polio vaccine, to a child in need in the developing world through Shot at Life. So we really encourage you, if you're watching this and you're listening to the importance of immunizations, both here in the U.S. and keeping healthy, which flu shots are a really big part of, but also if you've been to developing countries, you understand the importance of children's health and child survival, that you participate in this program here just with your family or right out of your own communities, and encourage others to do so as well. I want to leave one last piece from that trip to Tanzania that I think would be really valuable, and that is that we had the great opportunity to interview some children while we were there and to talk to them about what they want to be when they grow up. And you know that Shot at Life has always played off the words shot at. We say things like shot at kindergarten, shot at graduation. It's one of our favorite sort of milestone messages that we send out there. And so to ask these questions to these children, it was a real magical moment for us. And one of the things that we heard was a lot of the children started to answer the question with, if we grow up, instead of when we grow up. And that was really a moment for us where we sort of thought about the way that they were answering the question, and remembered that not everything is a complete guarantee for a lot of the kids that we were meeting, and the perspective was completely different. But at the same time, if you listen to their answers about wanting to become doctors or nurses or politicians or pilots, we really discovered from that is that the children are really not different from the children in our own lives here in the U.S., and that to us was probably the best message ever. So I really urge all of you to get a shot and give a shot through Walgreens pharmacies around the country. And now, LaVonne, I'd like to turn it over to you for some parting words for us as we get on this global movement to end childhood deaths.
Well, I want to just sort of end with You know, we do all really belong to each other, and I think that the Shot at Life shows that, and we're all connected as a community, and that we need to engage every community, and obviously Shot at Life has done this by mothers knowing that the community supports immunization for the children, bringing them a far distance. And we need to do that here too, that the community is connected, and there's a Walgreens on every corner, so you can get a shot during your lunch hour if you need to, or if your child needs some immunization. Certainly you can do that too. I know getting appointments is difficult in America sometimes, but we really do have a connection and a responsibility to keep each other safe and the community to help take care of each other. And I think that that's what's so wonderful, is that whether it be overseas or here through Shot at Life and through Walgreens and healthcare professionals, we understand, we protect each other by protecting ourselves, and that we are connected, and that we can make an entire healthier world by making sure everybody gets their shots and is protected.
Excellent. Thank you so much, LaVonne, for joining us, and for all of you out there that joined this chat, please spread the word. Link will be available, so those who weren't able to join, send it out to your friends so that they can watch this as well and learn a little bit more about immunizations for social good. Thank you, everyone.
Thanks.